everyone, today we're going to be covering some of my favorite exercises for GTPS, otherwise known as Greater Trochanteric Pain Syndrome. My name is Desiree DiLorenzo, and today we're going to be talking a little bit more about what this is. So Greater Trochanteric Pain Syndrome specifically entails pain along the outside region of the hip here. It's usually around the greater trochanter bone, which is the bone right here on the outside of the hip. It's where a lot of the muscle tendons attach to. There is a bursa in the area, and when that area becomes irritated, it can cause some discomfort. A lot of people will notice this discomfort when they're doing things such as sitting cross-legged. They might notice it when they're just putting direct pressure, like putting things in their pockets. If you're carrying a bag, like my dad's a carpenter, so he carries a carpenter belt, that can cause some irritation in the area as well. Some people might even notice this pain when they're going hiking. Other people notice the pain when they're going to lay in bed at night and they go to lay on that side, and that can create some discomfort here as well. So if that resonates with you in any way, if you're experiencing any of those symptoms, this video is likely for you. So we are going to be covering some of my favorite exercises today for that GTPS, or Greater Trochanteric Pain Syndrome. So the first exercise we are going to do here sounds a little counterintuitive. A lot of times when people feel pain, they think pain means stop, rest the area, don't do anything at all whatsoever. What we're going to do today is actually going to be a strengthening exercise for that glute to help create a little bit more structure and support to the area. And also, pain sometimes just means that it's weak and it just needs a little bit more attention. So to get started, we are going to set ourselves up on our sides like I am here. It's going to look kind of like a side plank if you've ever done a side plank before in the past. So elbow will be down underneath your shoulder. I want your knees to be slightly in front of your body as opposed to a full straight line like you would be in a traditional side plank. With those knees in that position, I want you to imagine like there's a bug right underneath this front knee here, and you're going to slowly roll forward over that bug and crush it. Okay? Once you're there, move away from the ground. I like to say like there's a fire underneath you and you're getting away from the fire. And then from there, you're going to roll so far forward and pick your body up off the ground. Okay? As we come down from this position, you're going to sit your hips down and back and come back down to the ground. That was one rep. Same thing again. Let's push down into the ground, roll forward and lift the hips up. And then you're going to work to sink back down once again. I like to challenge this one. I have this funny saying that I like to say, you're going to go till you feel nice and toasty in the buns. So that usually for some people is anywhere between 10 and 20 reps. Sometimes I just say go for time until you start to feel that sensation. Or as you notice here as I'm talking and I'm going through these reps, you might notice that I'm starting to lose my breath a little bit. So if that's you, as you're going through this and you feel like you're getting some good challenge here, I always like to go back and check out that exercise where you initially notice that discomfort. So I'm returning to this cross-leg position. You reassess to see if that is helping you. And if it does, it sounds like you're in the right place. So if this exercise really helped you, check out our webinar that you have posted here. You'll see a little link pop up somewhere here on the screen. If you feel like that was a little troublesome and you were still having some issues fine-tuning that exercise, don't hesitate to reach out to us. There is a little form that you can fill out to contact us. We can reach out to you, ask you a little bit about what you have going on, and help tailor a care plan that works best for you with this particular symptoms. So reach out. We're here to help you, and we'll talk soon.